Good evening. My name is John Whitehill, and today I'll be giving you a presentation that is focused around the evaluation of the Million Hearts Initiative supporting local communities, which is an educational campaign that is focused on reducing the prevalence of heart attacks, strokes, and acute cardiovascular events in disparate populations. The program is a smaller component of the CDC, or the Center for Disease Control and Prevention's National Million Hearts campaign that is focused on preventing 1 million heart attacks and strokes in the next 5 years. Million Hearts is a national U.S. Department of Health and Human Services initiative that is co-led by the Centers for Disease Control and Prevention and the Centers for Medicaid and Medicare Services. Its main focus is to align the efforts of federal agencies, states, regions, communities, and individuals around the epic goal of preventing 1 million heart attacks and strokes by 2017 by implementing proven and effective interventions in clinical settings and communities centered around the ABCs, which are aspirin when appropriate, blood pressure control, cholesterol management, and smoking cessation. There are many different components that fall under the Million Hearts brand. Million Hearts Initiative supporting local communities is one of many educational campaigns that are aligning under the national scope of the Million Hearts. The hopes of this program is to show that the educational piece of the Million Hearts component is effective and will be replicated in other communities and or rescaled to a larger region of the United States. This evaluation will help in the decision-making process since the focus is around barriers, facilitators, and education campaigns. This presentation will go over program stakeholders, purpose, which was just stated, and look at some of the communication results and data to be disseminated throughout the program. Finally, I will give some recommendations to the program. When working with stakeholders, it is important that stakeholders are identified, and this would include internal and external stakeholders. For this Million Hearts supporting local communities, one of the key stakeholders is the CDC Foundation, which is a nonprofit organization that creates programs for the CDC outside the federal restrictions of the government. They are the managers of the Million Hearts in supporting local communities program, and are providing fellows and staffing dedicated to the work within the program. Another key component or stakeholder would be the CDC. They're a federal agency who is providing the enhancement and advisement on the educational campaign. This includes the latest research, health scientists, and evaluation advisement. Pfizer Incorporated is a multinational pharmaceutical corporation that is co-founder for the project. KIND is an American public relations agency that is focused on healthcare issues. They also are a funder. Million Hearts in Action Communities. Now these would be the two communities that we are actually implementing this program and intervention in. This would be Richland County, South Carolina, and Clayton County, Georgia, were the communities that were selected for the program because they matched the demographic and had the data infrastructure to participate in the program. Quest Diagnostics and Catalina Health are both data infrastructure clinics in the selected communities. They have the data sets that the program is focused on improving and has established data sharing agreements. The purpose of this presentation is to discuss appropriate communication methods for the results of the evaluation. The intended audience for this presentation would be public health professionals and evaluators. As an evaluator, it is important to communicate data through the use of visuals. We will now look at some of the communication messages and tables that will be used for the results. Here is the table entitled Demographical Comparisons of Clayton, Georgia and Richland, South Carolina to the United States. This is a comparison table looking at the quantitative data that comes from the Million Hearts Initiative supporting local communities. Here we're looking at demographical data and how we can compare them for the entire campaign. The data and the information comes from the U.S. Census Bureau. A table here is needed when comparisons are done, and this makes it appropriate for disseminating the results from the evaluation. Now we're going to take a look at a qualitative representation. Now looking at the table, the Million Hearts Initiative supporting local communities patient activation model, this is a programmatic logic model of the engagement to activation for behavioral change. This is looking specifically at patients. Now this is different than having a table because there's no quantifiable numbers, but there are strong relationships between each of these sectors. So it is important to show the differences between an appropriate quantitative and qualitative The program has a strong understanding of the theory of change, as seen by the communication tables that were used. There are also many challenges related to an educational program and the outcome of change in health. There is also a lot of work related to the qualitative analysis, and this brings in problems related to the feasibility of the program to meet the needs of the stakeholders. My recommendations for the program moving forward would be to limit the scope of the project or to bring on more evaluators to help in the effort. Again, these are budget limitations that need to be addressed by the program. The budget does not account for the amount of work that this program has, and that would be one of my biggest concerns when looking at this proposal. That's all I have for this presentation. I hope you learned a lot. Thank you.